Sharp instrument injury is one of the most common factors for medical personnel to contract blood-borne sexually transmitted diseases. Correct selection and proper use of medical sharps can effectively reduce the incidence of sharp injuries by less than 50%. The sharp container in use should be placed in a bright light. No side occlusion, easy to operate, and within reach of the hand. Do not disassemble or separate used or exposed needles with your bare hands, taking care to follow aseptic handling principles.